As part of the Paths to Prevention series with Allianz, I'm meeting with Dr. Ulli Sucher to talk about cancer. 1 in 6 people will face a cancer diagnosis in their life. And what actually is cancer?
Well, cancer starts when cells in the body start to grow uncontrollably and evade the immune system that normally would kill them. Every day we produce cancer cells. You wouldn't believe that,
Wow.
but the immune system immediately removes them. So when that doesn't happen, cancer cells can multiply and spread across the body, fortunately.
And then what are the signs that people should look out for? The early signs of cancer?
Sometimes these signs can be very subtle. Like an unintended loss of weight.
Right.
Or when you have a cough that lasts more than 6 weeks. Change in bowel habits, lumps, as we all know, anywhere, especially in the breast, but in any other parts of the body. So all of these signs should prompt you to see your doctor.
One of the things I've heard is that 40% of cancers are preventable. What should we do to try and prevent cancer in our lives?
Stop smoking.
Okay.
Every cigarette contains about 4,000 carcinogens.
Wow.
It is responsible for 1 in 4 cancer deaths.
1 in 4.
It is recommended that you do about 150 minutes a week of moderate activity. Every little helps.
Okay, we are out here on a beautiful day. Sun is out, but sun exposure is a really important risk factor when it comes to cancer, right?
Yes, excessive sun exposure can give you one of the most malignant tumors we know, the melanoma. So you really want to avoid that by using sunscreen every day, and that should start in childhood already.
Screenings are so important when it comes to cancer. Why is that?
Yeah, both are actually almost equally crucial. So screenings are important because when you detect cancer early, it's much more treatable. In terms of prevention for women, is for a mammography, a pap smear, / HPV testing, human papilloma testing, and for men, it's the PSA test.
Well, talk about that for a second, because I think a lot of men are when they hear the word prostate, they start to freak out.
The
PSA testing, what's that?
It's a blood test.
Vaccines. I didn't even realize vaccines are so important when it comes to cancers, but they really are.
Yes, absolutely. We already have vaccines against cancer, against certain types of cancer. One of them is the HPV vaccine, which should be administered in adolescents. It's a vaccine against cervical cancer, basically. And then we also have the hepatitis B vaccine. So you might ask, why does the hepatitis? Hepatitis B is kind of an infection of the liver, but it can turn chronic. And when this turns chronic, it is kind of a precursor of liver cancer.
So it seems like if you make a little bit of an effort, make small changes, you can get a really big result.
Absolutely. Choose a month in the year, put it in your calendar, and do all your screenings. Then you don't forget, and you can relax the rest of the year.
That is brilliant advice.